Welcome to Uniting Voices. We're celebrating Spanish Language Day and promoting health literacy. My name is Chef Alex Askew, your host for this session, and I'm with BCA Global, an organization that promotes culinary diversity, food, race, and social justice. BCA Global has received funding from Region 2 for mindful eating for the beloved community in the Virgin Islands. And I will add that I'm also a member of the Region 2 Regional Advisory Board. So some housekeeping I want to go over. First, please take advantage of our translation services. You have to select the globe at the bottom of the Zoom window, click on your language preferences, and pick either English or Spanish or the language of your preference. You must be on one of these channels to hear all the presentations today. So I'll give everyone a moment to set up their channel and I'll pass it to Eric, who will translate into Spanish.
Buenos días a todos. Tomen ventaja hoy de la habilidad de poder escucharnos en la traducción por interpretación. Hay un globo abajo que les deja poder entrar al canal de español para poder tomar ventaja de esta habilidad de escuchar el canal en el español o en el idioma que ustedes gusten, ya sea inglés o español. Muchas gracias.
All right. So again, happy Spanish Language Day. A few facts that are really important to know about.
Sorry, excuse me, Chef Alex. We all need to get on one of the channels. So me and you need to go to the English channel right now, and other folks need to go to Spanish. Okay.
Okay.
By clicking on the globe. Yep.
Okay. It should be there.
Okay, I'm here with you. Yep. Good to go.
Okay. So happy Spanish Language Day, everyone. A couple of facts that everybody should know that's really important and relevant to this special day. The United Nations observes Spanish Language Day annually every year on April 23rd. And the United Nations Department of Public Information was established for this event in 2010. And then also, the UN established Spanish Language Day to celebrate multilingualism and cultural diversity and promote Spanish language inclusion. So Region 2 celebrates Spanish Language Day in support of health equity and access. And we encourage everyone to recognize this day amongst family and friends and engage in language justice. It's part of social justice, it's part of health equity, and support Spanish-speaking members, in support of Spanish-speaking members, which is a focus of Region 2.
Tracy, next slide, please.
All right, so here are the facts that I just mentioned that everyone can make note of, but it is a time to celebrate Spanish-speaking people in communities are very important in being inclusive and included in our community work. And so it's very, very important that we recognize this day and continue to recognize this day. Next slide. So I have the honor of introducing the presenter today, and I even will call her my friend, but what an awesome person Lauren Jackson is, and a leader of Region 2. I've had a chance to work with her for a number of years now. So let me just give you some of the cliff notes of her prestigious background. Lauren Jackson leads as the executive director of the Region 2 Regional Medical Library, Region 2 RML, as part of the network of the National Library of Medicine, or NNLM, located at the Medical University of South Carolina. Before her current position, she worked as the Research and Instruction Resident Librarian, Black Studies Librarian, and the interim head of access and user services at Swarthmore College in Pennsylvania. Lauren earned a BA, Bachelor's in Philosophy and Education from Harvard Ford College, an MA in Philosophy and Religion from the California Institute of Integral Studies, and an MI in Library and Information Science from Rutgers University. She began her career in the nonprofit and educational sectors a decade ago, and since 2016, she's worked in diverse library environments, including academic, public, special, and primary school libraries. Her research interests include trauma-informed librarianship and developing kind leadership practices in libraries. So I present the presenter, Lauren Jackson. Thank you, Lauren.
Thank you so much, Alex, for that warm and wonderful introduction. It is my pleasure to work with you, and I'm so glad that you're here today and a part of Region 2. Next slide, please. So, bienvenidos a todos. Me llamo Lauren Jackson. I'm so glad that you're here today. Welcome to everyone. And I'm going to go through our agenda to tell you a bit more about what I'll be presenting today. I'll start with some acknowledgements. I'll welcome you officially to the network of the National Library of Medicine, or NNLM, and Region 2. I'll review all of the wonderful events taking place today in this virtual forum, and I'll also go over some education and funding opportunities with Region 2. Next slide, please. So we always start our presentations with a land acknowledgement. Land acknowledgements are an honest and historically accurate way to recognize Native communities. Presenting land acknowledgements recognizes histories that have been systematically erased. The Native peoples of this region include the Etowah, Kiowa, Santee, Edisto, Natchekuso, and Wasamasa people. The Region 2 Regional Medical Library recognizes the Native communities of the land on which we live and work in Charleston, South Carolina. We commit to remaining mindful and to use our work to support the health and well-being of all people, including Native communities. Next slide, please. We also include a labor acknowledgement in our presentations. Labor acknowledgements recognize how historically much of the substantial economic development in a geographic area or industry resulted from the unpaid labor and forced servitude of people of color, specifically people from Africa. The Region 2 Regional Medical Library acknowledges that much of what we know of this country today was possible because of the labor of enslaved Africans, their descendants, immigrant workers, impoverished people, domestic workers, and others. We commit to remaining mindful and to use our work to support the health and well-being of all people, including those whose labor has been historically exploited. Next slide, please. We also have these community agreements. We'll do our best to adhere to these throughout today and all of the presentations. Take care of yourself. No one knows everything. Together, we know a lot. Make space, take space. One mic, one voice. Understand the difference between impact and intent. Respect confidentiality. Be curious and respectful. And these are adapted from the GLSEN guidelines for respectful GSA spaces. Next slide, please. Okay, so this is what we're a part of and the way that all these pieces fit together with what the Region 2 Regional Medical Library actually is. At the top of this waterfall are the National Institutes of Health. This is the nation's research agency with 27 institutes and offices within the United States. Beneath that is the National Library of Medicine. That's the world's largest biomedical library. It's actually located in Bethesda, Maryland. Then underneath that is the network of the National Library of Medicine, or the NNLM. The program of the NLM is the network, and it's comprised of 7 regional medical libraries and 3 offices. Next slide, please. So these are the 3 Network of the National Library of Medicine initiatives for this 5-year cooperative agreement that goes from 2021 to 2026. They are confronting health misinformation, bridging the digital divide, and also environmental determinants of health. Next slide, please. So where is the Region 2 located? Our service area includes these states and territories. So the region includes Alabama, Florida, Georgia, Mississippi, the Commonwealth of Puerto Rico, South Carolina, where we're located for Region 2, Tennessee, and the US Virgin Islands. So within South Carolina, our headquarters for the Region 2 Regional Medical Library is at the Medical University of South Carolina. Next slide, please. So let me tell you more about the personnel that actually makes up the Region 2 Regional Medical Library team. We have Angela Hayes, who's our grants administrator and our liaison for our members in Alabama and Mississippi. We have Fiona Washington, who is our program coordinator too. She's our liaison for Tennessee. And then myself as the executive director, as Chef Alex introduced so well. And I'm the liaison for the Commonwealth of Puerto Rico and the US Virgin Islands. Liaison basically means that we're your first point of contact if you're located within those areas. So for me, for our members who are in Puerto Rico or the US Virgin Islands, we ask them to reach out to me first so I can support. Next slide, please. We also have strategists on our team. So whereas the previous slide, the admin team really takes care of the operations and behind the scenes a lot, the strategist team is responsible for the ingenuity of our program. So that includes Sarah Fisher, who is our community engagement and outreach strategist. She is also the liaison for Florida as well. So she's the point person for folks located there. And Deborah Trogdon Livingston, who is our user experience and education strategist and our liaison for Georgia, as well as South Carolina. Next slide, please. Okay, so today's events, we have a lot going on, and we're so excited to see all of you here and to know that you're a part of this event today. So right now, I'm giving you that Network of the National Library of Medicine and Region 2 welcome. Then from 12:30 to 1 p.m. Eastern, we have a Medline Plus in Espanol overview with Javier Chavez. From 1 to 2 p.m. Eastern, we have Spanish for library staff, bringing language access to your library with Caroline Smith. And from 2 o'clock to 3 o'clock Eastern, we have Tata's Tales, Los Cuentos de las Tatas, the intersection of poetry, transformative writing, and drama in bilingual communities with Irania Patterson and Beth Murray. And last but not least, from 3 to 4 p.m. Eastern, we have Evaluación en Español, Consejos Prácticos para elaborar planes de evaluación de proyectos con Verónica Hoyo. So she's my colleague who works at the NEC, and she'll be presenting about evaluation in Espanol. So that'll actually be our presentation that is completely in Spanish with available English translation for folks. I'll also mention that we began planning this whole event last fall. So it's been a labor of love from all of the volunteers here today and from the whole team with Region 2. So we're so glad to have people participating today. The entire day will be recorded, so you can always revisit these sessions later. And we also encourage people to come when you can and leave with you when you must. So if you need to break up the day, take breaks, do other things, please be sure to do that. But it's okay to, attend as much as you can with us today, but you will receive the recordings later. This project has also been data informed to offer this half-day virtual forum. We've heard feedback from our members within Region 2 and beyond, just in the larger NNLM, that our members are looking for more Spanish language output. And we've worked together today to provide live translation, thoughtful health programming, and resources to all. So I'm really proud of this event from the entire team, from everyone volunteering, from our interpreters with Masterword, including Stephanie and Nicholas, who are here today, and Eric, and other members from that team. We just thank you so much for supporting this today. Next slide, please. So it's free to become a member of the network of the National Library of Medicine. In order to access this webinar, you had to be signed up, right? So everyone should be aware of that. But if you want other folks to have access to this information, they just have to go to nnlm.gov/user/join. And when you become a member or you sign up, you assign yourself to an organization. And from there, you'll be signed up to be able to receive our monthly newsletter that we call the Pulse. You'll have access to our blog, which we call the Southeastern Spotlight. And also, when there are emergency communications, you'll be on our listserv to receive those as well. So it's free to become a member. It gives you access to many opportunities and some of the things I'll explain on the next slides. Next slide, please. One of those pieces of access is definitely with this training today. So we offered, bilingual promotion for this event for Uniting Voices, celebrating Spanish Language Day and promoting health literacy. This is something that went out to all of our members so that they were aware within Region 2, but also outside of Region 2 to be able to participate. So access to those trainings comes with becoming a free member. Right now, Region 2 also is offering free Medical Library Association continuing education passports. So if you are a health sciences librarian or you're interested in taking advantage of some of those trainings happening through the Medical Library Association or MLA, you can send your name, your institution, and where you're located to our email address, region2@nnlm.gov, and we will pay for your MLA CE passport to have access to those professional development opportunities. So we definitely encourage that and have access to be able to provide that to anyone who emails us. Next slide, please. We also offer specializations through the Medical Library Association for free. So when it comes to the MLA Consumer Health Information Specialization, or CHIS, the Data Services Specialization, or DSS, and the Systematic Review Services Specialization, SRSS, we can provide those for you and pay for them on your behalf. So that is definitely available and gives people an opportunity and access that they might not otherwise have. This is pretty specific for folks who work in health sciences libraries, but we wanted to make folks aware who are here or who are connected to institutions or need that training that is available. Next slide, please. So we are open for grant funding right now. Our grant funding cycle goes from May 1st, 2024 to April 30th, 2025. That will be year 4 of our 5-year cooperative agreement, which started in 2021 and goes to 2026. Applications are currently open for Region 2. So you must be a member within Region 2 in order to apply for funding. Those applications will close on May 17th, 2024 at 11:59 p.m. Eastern. So remember, you have to be a member to apply and also located or working within Region 2. A little bit about the award categories. The awards that are available to apply for funding are the Health Information Outreach Award, the Professional Development Award, the Exhibit Award, the Emergency Preparedness and Response Award, Innovation Impact Award, and Library Student Development Award. For health information outreach, it's anything related to health information outreach. For professional development, same thing, self-explanatory. Exhibit award, when you're going to exhibit or present at a conference and you'll have a table or you're interacting with the community, that's what that award is for. Emergency preparedness and response has to do with anything related to emergency outreach, but also preventative measures that you can take as a project to support people being able to respond in an emergency. And there's lots more information about all of these awards at nnlm.gov/funding. So if you're interested in applying, you can find more there. Also, we have the Innovation Impact Award. That's for any award type that does not fit squarely within one of the other categories. So it really has to do with anything that is kind of outside of the box, unique, innovative, that will still connect with the overall goals of these awards, which is supporting health information and people having access to things that they might not otherwise have, in terms of connecting with what we do within Region 2. And last is the Library Student Development Award. So that's particularly for students who are interested in presenting at a conference in the fall after working with professional development with Region 2 throughout the summer. There's also a proposal writing toolkit that is available that gives more information about all of these different awards and the process of applying for funding within Region 2. Next slide, please. So one of the focus areas for Region 2 this year and what we're continuing to do is a focus on priority populations. And one specifically has to do with language justice. Region 2 has partnered with Reforma de las Carolinas. So we've worked with that chapter of the American Library Association, which is and represents North Carolina and South Carolina. So it actually connects with Region 1 as well as Region 2. And I've been attending meetings. I've had a chance to present with them. They've been a fabulous resource. And we actually have representation from Reforma de las Carolinas with the presenters today. So that has been one way that Region 2 has promoted language justice. Also, we have, of course, this webinar today and this virtual forum. So we're so glad to celebrate UN Spanish Language Day with all of you by having this today. And then we've done some Puerto Rico outreach. So we had a site visit that happened in December of 2023 with all of Region 2, where we were actually in Puerto Rico for 5 days. We worked with different community organizations and nonprofits. We also went to the University of Puerto Rico and worked with some folks at the Health Sciences campus there. And they're also represented here today. In part, we have some representatives, Pedro and Rosana. So we're so glad that you're here with us and they're supporting and volunteering for this webinar as well. In our blog, the Southeastern Spotlight, we had a feature that also had a love letter to Puerto Rico. So you can see more about that there as well. Next slide, please. The NLM and NNLM, or National Library of Medicine and Network of the National Library of Medicine, has some Spanish language resources. We'll learn more about Medline Plus in Espanol in our next presentation. We also have resources for public libraries and some YouTube links for different resources in Spanish as well. Next slide, please. So this is how you can get in touch with us. You can find us on Facebook as well as LinkedIn at NNLM Region 2, and you can email us with any questions or get back to us at region2@nnlm.gov. We would love to connect with you. Next slide, please. All right, so last but not least, I have some thank yous for all of the people who are supporting today. Our presenters, Javier, Caroline, Irania, Beth, and Veronica. Our volunteers, Chef Alex Askew, who is the host for this session, and also we have some folks who have been helping behind the scenes with technical things. That includes Deborah, Tracy, and Mary Ellen. So thank you so much. Gail is helping today, Rosana, Pedro, who I mentioned earlier, Frank, for sure, Frank Fajardo, thank you so much. Our entire Region 2 Regional Advisory Board, and of course our partners with Masterword and the larger NNLM Region 2 team. So thank you so much. That's my presentation, and I'll turn it back to Alex.
Okay, thank you, Lauren, for such a great presentation. I'd like to close this session and introduce the next session coming up next, which is a 30-minute Medline Plus in Spanish overview with host Deborah Trojan Livingston and presenter Javier Chavez. I will just say that Medline Plus is a huge resource. I encourage everyone to sign up and explore it. We were able at BCA Global to really benefit from Medline Plus. So just another plug that everyone should engage in this very, very important platform. That's all, folks.
Thank you, Alex. I'm just going to switch everyone over for the next session, and we'll get started right at 12:30 Eastern. Thank you all so much.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.